It is a question that has been asked many times. Will I survive my breast cancer diagnosis, and will there ever be a cure? Those are the questions that I asked Mayo Clinic Dr. Yadav as we continue our conversation.
Generally speaking, I think we are making significant progress in treatment of breast cancer. Obviously not just in early detection, but also patients who have been diagnosed with metastatic breast cancer. We are now identifying genetic alteration and targeting them and making them live longer with good quality of life.
Let's talk a little bit about metastatic breast cancer, because I've heard so many people, once they have breast cancer, once it metastasizes, then that's becoming so much higher risk. How important is that in identifying early in order to keep it from metastasizing, or is that individual as well per patient?
It is when we think of screening, that's one of the reasons why we talk about understanding who is at high risk and doing aggressive screening to detect cancer early. One of the biggest risks of who gets metastasis versus not is the initial stage at diagnosis, meaning if somebody is diagnosed with breast cancer at very early stage and it's just in their breast, the chance of cure and that it will never come back again goes over 95% or so. Whereas if it is already gone to lymph nodes, for instance, that number quickly drops down under 90% or so, right? So you can see this is why it is so important for women to go for their screening and obviously detect cancer early so that we can influence outcomes.
And we've heard a lot about fibrous breasts lately. So when you talk about screenings, we're talking about mammographies, but now they're talking about ultrasounds, right? In order to bypass what might otherwise be a heavy, dense tissued breast. Is there anything else with regards to screenings that you would suggest? Because truly early detection is where it's at. It's where it starts.
Absolutely, and this is where, that's why I earlier mentioned about risk assessment, is what kind of screening modalities we use depends on the risk. In somebody who is average risk and do not have dense tissue, mammograms alone might be enough. But in somebody who is considered as high risk, right, so we look into, now we have tools that can predict what is a woman's lifetime risk of developing breast cancer. And if they are at high risk, we would often recommend doing MRI screening, or we have what we call as molecular breast imaging at Mayo Clinic, so MBI, MRI, in addition to mammograms. And these tools are known to pick up they have higher sensitivity in picking up breast cancer early on.
Yeah, so we are seeing so much more success. What would you say compared to maybe 10 years ago, which was probably a little bit before you got to Mayo Clinic? How much more of a success rate are we seeing with survival rates?
I think there has been a tangible shift in the survival rates. It is still, when we look at these data, what we are doing today, we will see the impact on survival 5 years from now, because it's always we always measure survival down the road. And I'm very optimistic that we are making tangible progress here, and that there will be a time where we'll obviously be curing more and more patients than what we are doing today.
Now, this is probably a tough question. Do you see any time in the future, maybe in my lifetime or possibly yours, that we will have a cure for breast cancer?
I personally think yes.
Is that right?
I am very optimistic, like I said, right? Right now, we already cure majority of patients by early detection and doing all these treatments, right? Where we are facing challenges is in the metastatic realm, where patients already have the disease spread to their lungs, liver, bones, right? The challenge, even in that space now, with some of these effective treatments, we are seeing such good results. I have several patients who, despite having metastatic disease, are completely disease-free and have been for several years now. And we don't call them as being cured yet, but if you're disease-free for 5 years, 10 years, I mean, at some point, we'll start calling them as being cured. And granted that that number is small right now, but with these effective treatments, that number keeps on growing and growing, and that's why I'm optimistic that someday we'll get to a point where we will be able to cure metastatic breast cancer.
From your lips to God's ears, Doctor. Thank you so much for joining us and for your insights. We greatly appreciate it.
Thank you very much for having me.
And tomorrow we will tackle the topic of reducing your risk and ways to prevent a breast cancer diagnosis in the first place as we continue our Inside the Fight of Breast Cancer series.